So this video will depict the examination of the external structures of the eye. And again, we're going to wash our hands, and what I'm going to do here is take a look at your eyes. So mainly we're going to use inspection and some palpation. So the eyes are clear and bright. The sclera is white. There's a little bit of pinkness, but that's not abnormal. So what I'm going to do is I'm going to check the conjunctiva. So there is the bulbar conjunctiva, which covers the eyeball, and there is the palpebral conjunctiva, which covers the lid. So I'm going to ask you to look up, and I'm checking, and it's pink and moist, and then look up, or down rather. Okay, good. So usually you need to only check the lower conjunctiva. And the only time that we check the bulbar conjunctiva is or the palpebral conjunctiva for the lids, the upper lids, is if there's a foreign object and we'd have to roll the lid. The other thing I want to take a look at is the anterior chamber, and to assess the anterior chamber, I'm going to ask you to look straight ahead. The anterior chamber is the space between the cornea and the iris, and it should be clear. But the only way you can see this is to look from the side. So I would examine that from the side. Okay. Okay. And then the other thing we're going to take a look at is the pupils. So the pupils are largest when you're a baby, and they get smaller as you get older. And what we're looking for is their reaction to light. And so there is a direct reaction, and the direct reaction is that they should constrict. But remember what I said, when one eye is doing, the other eye should also be doing. So when we shine the light in the right eye, that left eye should also be constricting. So what I'm going to do is take a look at Zair's eyes. Look at me for a second. Right at me. And then I'm going to shine the light. And I'm going to look for pupillary constriction in both eyes. And then I'm going to do the same thing for the other eye. And they both should equally constrict and react, and they should do it briskly. So you're looking not only for the reaction, but the speed of the reaction too. And these are always included in a neuro exam because they change when there's signs of increased intracranial pressure. Now there's one other test that you can do for the pupils, and that is accommodation. So what you have the client do is focus on something far and then near. And if the eyes can accommodate, the pupils should constrict. So there's two ways to do that. What I can do is ask you to look at my finger, and now I'm looking at the pupils, and as I move my finger and just stay focused on my fingers, the pupils should constrict and the eyes should converge, okay? The other way you can do it is have them look at an object, look at the hand sanitizer on the wall, and then come back here to my finger. And again, what should happen is the pupils should constrict and converge, okay? Now, there's another test that we want to do, and that is we want to check the cornea. And the cornea is very sensitive. The corneal reflex protects your eyes. And typically what we do, one way to do it, is to get a wisp of cotton and just gently touch the cornea. I don't prefer that way because I don't want to take the risk of scratching the cornea. The other way you can do it is get a syringe, a needleless syringe. Say here, look straight ahead, and I'm going to puff some air over your eye. And what it should do is it causes the patient to blink. The other thing you can also do is do what they call a blink reflex and just run your fingers over the eyelashes. And again, that should cause them to blink. So there's one more area we want to take a look at. It's the eyelids and lashes, and also the lacrimal glands and ducts. So the lacrimal glands are here, so we're just gently palpate. And the inner camp is here where the ducts drain. And nothing should occur. Is that hurt at all? No. And they should be non-tender. If the tear glands were blocked, you'd see excessive tearing. And you want to note the position of the eyelashes. They're curved. They're not abnormally inverted, which could scratch the cornea, or abnormally everted, which again could cause scratching of the cornea and also excessive drying of the eye. And there's no lesions. Take note of any lesions on the eyes or eyelids. Thank you.